So thanks very much for being here, Matt.
Hi, everyone. Great to be with you. Yeah, thanks for that introduction. I've stepped out of my role as a public health officer about a year ago to join Dr. Caitlin Genelina at Your Local Epidemiologist, which is a public health communications platform, because I learned over the course of the pandemic that, trying to lead our community through that experience, that perhaps my most important role, or many of the hats that I was wearing, was as a translator of what was occurring, as a communicator of engaging communities and really defining the problem and having a shared understanding of what's at stake so that we could have a shared understanding of the strategies to take to address it together, including whether that's masking or vaccines, et cetera. And it was a huge learning curve for me. And I think we've all learned kind of the hard way that many of those communications may not have actually landed in the ways we expected them to in American communities. It's explained by, low vaccination rates and now divisiveness across the nation. So I'm really interested in kind of rethinking how we communicate about public health. So what you're going to hear today is um, a series of problem statements around what we think is at stake right now and what is the trends that are driving the challenges we're experiencing, but also a set of solutions that are nascent. This is new space. We are trying to innovate. So I hope you'll be able to engage with me in that spirit because I think right now we're all trying to sort of figure out, I think there's what to do, and there's, I think, lots of potential right answers. And you all, your perspectives, I think, would be very important. I also want to just also acknowledge and thank the UC Berkeley Social Impact Fellowship Program. I'm a social impact fellow. I have the privilege of working with 6 UC Berkeley students on your local epidemiologist, and I always find their perspective super useful. So I'll start by showing my slides. Can you see that?
No, we don't see it yet.
Oh, sorry.
Okay.
I was sharing. Let me go try that again. It worked when we practiced
I
it.
know, I know.
Hold on, let me just bring you up. Well, while I'm doing that, I just want to I just did a video with my puppy, and is a good example of how far I've come from my role as a public health officer, where I was, very formal in my communications to sitting in my backyard with my shorts, holding my puppy to talk about vaccines, which is a new world. I'm sorry, I'm still having trouble bringing this up. I'm sorry, I'm having connected. I'll be right back. If you can just hold the
Okay,
group
sure.
for
You,
about
you
two
you could
minutes, I'll be
always
right back.
you can always email it to me if you want, and then I could share the screen
Okay.
if
All
that's
right.
easier.
I'll be right back. Hold
Okay.
on. All right. Can you see me now?
Yes. Yes, now we see it. We see your screen, and then you can just go to the slide. So
Great.
great. Sorry that you're
Apologies
having
for that.
all
I don't know what
good.
happened there.
There you go.
All right. So
Great.
this is a an image from uh, the 1820s, and this is just to make the point that ever since the dawn of vaccines, we've been challenged dually with of the operations of getting vaccines developed and getting them out into the community and making sure that people who have access, who need them, have access to them, with also the communications around their safety and efficacy. This is a political cartoon from London, just after Jenner, who's represented there in the middle, who developed the smallpox vaccine, um, began actually being able to inoculate people with the cowpox, which was actually able to confer immunity against smallpox. Um, and as soon as that rolled out, and it was an evidence-based at that time solution to the potential risk of smallpox, um, there was the anti-vax, basically the anti-vaccine society developed. So anti-vax or vaccine hesitancy and vaccine concerns have been with us really since the beginning. And it emphasizes the point that we can't just focus on the science. We also have to equally focus on the way in which we communicate the science. Um, Again, trouble technical. There we go. So when it comes to communications, obviously the landscape is changing dramatically. One of the things that I think is most important for us in public health communications right now is actually making ourselves seen and visible. We have held as sort of a matter of a badge of honor, if you will, to sort of say that our story is that when we work in the background, public health saved your life today and you didn't even know it. When public health works, it's invisible. In fact, this PBS series that recently came out was about the invisible shield. Um, Unfortunately, people don't protect or defend what they do not see. And so part of the my objective is to try and help us see how we can be more effective as communicators about public health itself, to lend value and an understanding of the value of public health so it can be defended. These are just some examples of what's declining now and by way of support for public health just in the past year or so. 50%, 53% reduction in CDC, 43% reduction in staffing at CDC. About 20% of local health departments are reporting using job losses. This was a survey that was conducted by NACCHO recently. Hundreds of NIH clinical trials have been impacted. They're targeting health equity, climate change, HIV harm reduction programs, health, emergency preparedness and vaccines, and public health may not be considered a professional degree any longer. So it doesn't feel like an overstatement to say that we are under attack of a certain kind. So we're facing a five alarm fire of invisibility. And that's a quote from Caitlin Genlino, who is the author and founder of Your Local Epidemiologist that I work with. These are some of the aspects of the new information landscape that we're coming into. Obviously, the most important trend is the increasing use of social media. About 90% of Americans use social media for acquiring information, which obviously would not have been the case just 10 years ago. There's declining trust in news media, both among Republicans and Democrats. There's declining trust in institutions. While scientists are still highly trusted, there's a concerning downward trend in science and scientists. There's also just an overall declining trust in government. Um, if we look back, in terms of the United States, there was about, almost 80% of people back in the 60s said that they could trust the government would always or almost always do the right thing. And that's down now into the 20s, 20 percentile. So, which basically the converse is that almost 80% of people say they can't necessarily trust the government to do the right thing. There's obviously declining trust in the CDC, and this was done in April of 2025. It'd be interesting to do that survey again now because of even more recent with the ACIP and the immunization committees that have been replaced by RFK for people who are vaccine concerned or vaccine hesitant. Trust is declining even further. So the question is, if these sort of historical pillars of trust and trustworthy information are being undermined, where is that trust being extended? It might be easy to say it's going into social media space, but there's a lot of uncertainty about that actually now among these wellness influencers. In fact, the majority of people say that they don't trust or don't know if they say that it's difficult to know, or they're somewhat difficult to know who to trust among wellness influencers. At the same time, we're seeing a strong sort of secular rise in what we call the curiosity-driven class. This is maybe many of you on this call who are sort of grew up in an area where you are actually able to answer questions by querying your smart devices, et cetera. That's when I grew up, that wasn't a possibility. So any question can be answered almost immediately. And in fact, younger people, age 18 to 34, are more than twice as likely to report that they can know as much as a doctor by just a query. So, about 45% of people in that age group say that with a few search terms and queries online, they can actually learn as much about a given topic as their doctor, which is an emerging trend around the themes of trustworthiness around healthcare providers. Political party also importantly is becoming even more of a determinant on beliefs around science, especially around vaccine beliefs. I just saw this today and thought I would include it because it was remarkable to me that just from like October 2019, that middle red, October 2019, about 79% of Republicans thought that healthy children should be required to be vaccinated to attend public school because of the potential risk for others. That's now dropped to about 50%. And 47% will say that patients should be able to decide not to vaccinate their children, even if that may create health risks for others. So I think this is a harbinger for new conversations that are coming around the likelihood that vaccine mandates will be newly challenged and will, in fact, have a lot of public support. So there's this paradox that we're coming into, which is more information means less certainty. And we just need to have our eyes wide open towards that as public health communicators. One of the most important issues I think we're facing is that this is a great head-to-head trial in 2018, published in it might have been Nature, big journal. Basically, they took a falsehood and a truth and put them out into social, like a head-to-head race into social media at the same time, and described their kinetics, how fast they moved, where they moved. And it was really kind of a stark illustration of the fact that the truth is in some ways categorically disadvantaged from falsehood. The falsehood reached more people more rapidly. It was more retweeted. It was more spread within peer-to-peer groups. It moved 6 times faster, and it had a lot more impact and reach than the truth. And if we step back, it makes sense. And this is some of the concepts that are described in the book Nexus, which I recommend. But the truth, if you think about it, the goal is to describe truth, is to describe nature intrinsically. Um, and from a science standpoint, we all know, especially you in where you sit in academics, know that takes time, it takes research, it's a rigorous process. It's often the answers are often inconvenient, it is often incomplete and evolving. It's narrated by nerds like us, and it's held more formally in institutions and peer-reviewed journals that might be behind paywalls and government reports. Contrast that to like the falsehood, which anyone can come up with at any time. And this is reminding me of what RFK is doing now, which is really designed to attract followers or votes or support or whatever. It's instant. Anyone can invent it at any time. It's often simple because it is engineered to actually gain psychological following. It's attractive. There can be multiple versions. You can just pick your own. And it is narrated by influencers. It's narrated by people who are charismatic in that way and are choosing to offer those messages in order to gain followers. And it's held informally. It's easily accessed. There's no paywalls around that stuff, usually. Some of the early efforts around scientists are recognizing, okay, we need to move into this space of social media are sad, sort of sad examples. This is a just two contrasting social media posts. On the right there, you have a public health department's effort. This is a real example of sharing that basically pasteurization it makes milk safe to drink. And the title is HTST, pasteurization process effectively interferes the H5N1 virus in milk. So it's this long title. And it gets like 53 shares. And I can just feel for that guy that wrote that because I'm sure he was like, I'm killing this. This is amazing. Like pasteurization works. We're going to get it out there. Everyone's going to love it. As opposed to the one on the left, which is, the dairy industry does it like conspiratorially talking about, health enzymes that may or may not be evidence-based, but, over 2 million views. So we need to learn some of the strategies that are also being employed by people who are effectively using social media. So in short, communication has always been a core public health challenge. Invisibility is a threat to our field. The sources of trusted information are shifting, and we need to rethink and innovate as a community. So we are at a crossroads. And this is how we move from invisibility to visibility. And there's three core principles I want to share with you. The first is moving from information to engagement. The second is cultivating trustworthiness. And the third is focusing on messengers. This is I trained as an epidemiologist. I was at CDC doing the Epidemic Intelligence Service. And there was a lot of rigor as you need, as necessary, around the methodology itself, around epidemiologic inquiry, defining, finding, gathering, exploring, cleaning the data, analyzing the model. But there really is a kind of historical practice of sort of letting that be an end in itself by epi and then leaving it at the doorstep of whoever would take it, sort of like cat food, to like do what they will with it. And we need to move beyond that. It's not enough. It's really important that we also tell the story. And I think we're learning that storytellers win. Um, so science isn't finished until it's communicated. This is one of the cartoons I like. This sort of describes this in terms of scientists going apples, 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 and the public's going, I think I heard them say oranges, oranges, oranges. Um, and this is Einstein. If you can't explain it simply, you simply just, you don't understand it well enough. And I know that from my own communications now. It actually is harder to make something simple than to just understand it in its complexity and repeat it. This is another important theme for us right now, which is the emergence of misinformation based on all those social media platforms, et cetera, that I just described. In terms of right now, we're putting a lot of effort into combating misinformation. There's been legislation. There's the FDA, FDA was grappling with the problem of health information. We're engaging libraries. I spent a lot of time as a health officer trying to sort of read where misinformation was and offering a series of like myths versus facts kind of statements. I'm going to suggest that might be kind of a never-ending battle and barking up the wrong tree. And this is why we have to think about, what does misinformation actually arise from, right? It is a symptom. It'd be like, from a clinical standpoint, it'd be, treating a rash that's actually due to someone has cancer, for example, and they have a skin manifestation of that cancer, and you're putting like steroid cream on the skin rather than actually going through the deeper process diagnostically to determine what is causing that. The similar, I think, can be said for the problem of misinformation falsehoods. Microchips in vaccines isn't addressed by just saying there are no microchips in vaccines. You're an idiot for thinking that, or whatever the narrative might be. Um, we need to sort of step back and understand what is the setting in which the soil in which those kinds of myths and misinformation arise, and get to the root. And that's what's beneath the water surface and the tip of the iceberg. And actually, in that environment, there are lots of people with very reasonable questions and concerns and hesitancy that, if we're more effective in addressing, I think we're actually going to get to the root of a never-ending series. It's sort of whack-a-mole of addressing misinformation. One important thing I found was that recognizing that we are in public health often in an information echo chamber. And I think the same can be said for academics, where this is a modeling effort that was done by MIT to describe channels and connections between social media platforms like Facebook. And the blue were pro-vaccine, vaccine favorable, and the red are vaccine hesitant or vaccine concerned or anti-vax. Um, the green are agnostic regarding vaccines. And what you see there is, and this is sort of the way I think of this graphic, as like, the high school cafeteria or a cocktail party or whatever. It's like you've got the people of, gathering together, you got your jocks over here and you've got your theater people over here, and and it's like, who's talking to whom? And what it shows is that like the pro-vax people are up there on the top together, talking to each other a lot, right? And then the red near the bottom, you have people who are more, the sort of more vaccine hesitant, are much more embedded and closer to people who are uncertain. Um, and I've experienced that. In that echo chamber, when we are critical of people who are vaccine hesitant, we receive a lot of applause from our own peers. And it may seem that we are successful in our messaging, but in fact, we are not reaching so many of those individuals who are vaccine agnostic. And they are, in fact, getting more closely touched by vaccine hesitant voices. So the answer is partly building bridges. And this is me and Jay Bhattacharya, who's now the head of the National Institute for Health. Um, I was invited by Francis Collins, who had been the prior NIH director, to join in a conversation slash debate with Jay in Kenosha, Wisconsin, in 2020 and into 2024, with a group called Braver Angels, which is a really wonderful nonprofit that tries to bring red and blue voices together for a new kind of conversation. And the topic was, what are the reasonable restraints of public health authority? And here's what I learned, and it was a great experience. I mean, I'll just say, like, coming out of that, I felt like I had a much better sense of Jay as a person, that his heart is in many ways in the right place. He, like me, wanted what's best for people. He had a different intellectual, had a different idea of how we would achieve that. But there was a lot more alignment, which is almost invariably what occurs when we have face-to-face conversations. And I don't know if you all remember the Great Barrington Declaration. This was in October 2020, when, we had gone through a series of lockdowns for what they were calling lockdowns for the pandemic response. And Stanford, Harvard, Oxford epidemiologists wrote this essentially just a two-page document that said, like, we should basically do focus protection, protect the most vulnerable, and let it rip for young, healthy people and allow herd immunity to occur. Um, it got a lot of press, and it was, um, epidemiologically and societally probably impossible by nature, right? It was not a good idea. But the Biden team response, Francis Collins, at that time, obviously there was a lot going on, and there was a lot of stress just in the environment. But his response was basically that there needs to be a swift and devastating takedown, and an email to Tony Fauci, and that was FOIA, Freedom of Information Act, and it became this catalyst for this notion that there is censorship occurring, and that is not an unreasonable response. And my conversation with Jay, I think, was mutually respectful. I think he heard some of my perspective. I think it was important for people to hear how I felt as a local health officer facing the decision of whether to keep schools open or keep schools closed. Um, what I learned from him is that based on that response, he felt dismissed, excluded, censored, shut down, labeled anti-science, vilified, and blacklisted. And that became an important rallying cry for what has now fomented into, I think, a lot of what we're seeing now in RFK's behavior. Um, so I think it's important for us to sort of recognize the lesson there. And it's not an uncommon perspective. Now, 40% of Americans believe that we were too restrictive during the pandemic. And some of those beliefs arise from the fact that they were not able to have those conversations where we were actually engaging the reasonableness of some of those perspectives. This is an example of what it looks like to demonstrate engagement, especially across party lines, because of how divided things are. This was just Los Angeles County opioid overdose crisis response. They have a beautiful coalition that spans all sectors, including law enforcement and first responders, as well as harm reduction people, as well as clinicians, community-based organizations, educators. And it is an example of a successful community coalition that brings together people from all sides. The next principle is to cultivate trustworthiness. That's achieved through, I think, three kind of principles of trustworthiness. This is in my communications. I always try and say, what do we know? I'm not going to pretend I'm not expert in things that I am expert in. I'm a physician, epidemiologist. I generally know that when it comes to a virus that's moving through the community, that I probably know more than most. So I will share what I know. Um, but I also share what I do not know and how we're going to find answers. And the tone, some of this is tonal, but this tone that we are learning together rather than this is how things are as a unidimensional communication tone, I think is critical for us in terms of transparency. One example of the way transparency works in terms of the media, that we're actually putting out. I thought the CDC did a nice job on this. A flu vaccine can take flu from wild to mild. So it's acknowledging right up front that the vaccine's not going to protect you from infection necessarily, but it will reduce the severity of disease. One of the lessons learned in the pandemic, we made an error to oversell the fact that the vaccine would actually prevent infections when they are occurring. The next that I think is probably most important to me, I guess I'll just back up and say that as health officer in Marin County in 2015, Marin County had some of the lowest vaccination rates in the nation. We had some of the highest rates of personal belief exemptions. And we began by doing surveys and listening and setting up town hall forums. And I traveled around to schools to have conversations with our public health nurses. And it really was a game changer in terms of changing the conversation. And this is one of the reasons I'm so connected or convinced that this is the way we should be moving. Empathy. This is like a New Yorker cartoon. One of the things that liberal people like me, read. If you connect the measles, it spells out my parents are idiots, right? Which is humorous in a certain way, but if you think about how that would actually read to someone who's on the other side, who's like not vaccinating their child, it's snarky and alienating. And the media's full of it. These are other headlines around just the vocabulary, insane, stupid, dumb, absurd, that's used towards people who are choosing not to vaccinate. Dr. Dan Siegel is a guy I had a few conversations with around this, and he wrote a book called Mindset. He's sort of an expert in child attachment. And he describes sort of the situations in which people are able to think broadly and use their imagination and make good decisions, or even change their minds. And he says the four S's: people feel safe, secure, soothed, and seen. And the opposite being defensiveness, misunderstood, threatened, or angry. And I think I would say that labels like anti-vax, anti-science, we need to be very careful in how we use those because they lead people into that second category of defensiveness where minds are not going to be changed. In fact, often we're going to see sort of doubling down, and I think we're seeing the results of that. So empathy is critical, and then a personalization, being consistent and being present and being reliable. And this was during the pandemic. This is Tedros, World Health Organization. I thought he did a really nice job, just every week getting out there, speaking his truth, or whatever was occurring, the status updates, but also being honest and transparent about all that we didn't know. We translated that strategy into Marin. As health officer, this is the way we tackled the pandemic, and this is part of the sort of principles I'm trying to bring to myself, my role as a communicator now. My life during the pandemic evolved into just a series of weekly, like every day, like Zoom meetings with all sorts of different sectors, just communicating, describing what's happening, what we're seeing, sharing the numbers, sharing where we're seeing gaps in vaccines, sharing where we're seeing high levels of uptake, where we're seeing the virus flowing with different sectors. So hospitals and clinics, schools, long-term care facilities, our volunteers, with an extremely, almost like radically transparent approach. Daily public status updates. I did over 200 videos. We did regular press releases. I had a policy that if any media reaches out, doesn't matter if it's Fox News or anyone else, I'll just have that conversation. We established a website and use social media. So frequent, consistent communication is also really critical. And then the final principle is focusing on the messengers. This is the historic model of public health. Kind of when I came into public health in 2000, it really was sort of the effort at the top level. And this is also true. I think this is sort of like a public health department and an academic setting. Like you're really working on trying to sort of understand the truth and then translate that truth as effectively as you can to communicate down to or out, whatever term you would use. But it is an outward and almost a unidimensional. It's a unilateral relationship. And one of the things I learned during the pandemic very early on, when 90% of our cases in the first couple months of the pandemic were among our Latinx residents, like 86%, and they made up 18% of our population. So there was clearly something happening there that I didn't understand. I knew I didn't understand it, and I reached out to people that I'd already formed relationships with in that community to say, how do we, like, what are we getting wrong? What do we need to do differently? And really accepting their leadership in that way. And that is the trusted messenger network, and where our trusted messengers can reach out households directly. Um, I'm reassured by this. This is the Pew Cert research. It just said that did a survey that basically asked where people when they can trust, when they can tell the difference between what's true and what's not, and who's narrating. Um, and basically, if you look at that bottom one, it's not too, most people say it's not too hard to, or it's not hard at all to trust the difference between what's true and what's not when you're speaking to someone you know. Um, versus watching cable news, social media, or listening to elected leaders. So to me, there's still this sort of reflects the hope that like real life relationships, despite all the social media that's occurring around us and the craziness politically, that there's still hope for like at the community level um, for us to reach people in real relationships. This was the strategy we employed in Marin. I think was successfully employed everywhere else as well, and or in other places where you recognize that there is a circle of trust around an individual that they relate to in their everyday life. Their providers, their healthcare providers, pediatricians, employers, places of worship, libraries, community services, our schools, all are really important as not just really important as narrators of health information, not just in their intrinsic role as a school as a teacher, but also helping those teachers actually understand and transmit important health information, especially in the crisis like a pandemic. This is how we identified our trusted messengers with basically two key questions. Where does a family naturally go in their everyday life? Like going to soccer games, they're going to church, they're going to synagogue, they're going to school, they're going to library, whatever. That's where they go. You have access already built. And then whom have they already established trust? And in fact, those almost always align. And that becomes your set of trusted messengers that you as a health department or we as communicators need to reach those individuals who hold those positions, rather than expecting to reach households directly ourselves. And this was a great example of how that played out in Marin. We had an 8-year-old child named Rhett Crowett who became a trusted messenger in our community. He had leukemia, was not able to get vaccinated, um, basically stepped forward and said, I think others in my classroom should be vaccinated because if I get this illness, I cannot be protected and it could end my life. And it was true, factually true, and also incredibly compelling as a story. And that's Rhett now. I just wrote a letter of recommendation for him for college. We've stayed connected, and he met Tony Fauci last year. This is another example of just how that trusted messenger network can build into the local. This is someone who was known within West Marin, was able to speak with conviction and in a way that is trusted by the community. I'm not going to pretend to know. So I'm what I've defined there is I think a lot of it is intuitive, but it's important to recognize that there is actually formal infrastructure we need to build to build that trusted messenger network. The other piece is we do not know yet what the social media version of that looks like for public health. What is that relational dynamic that we know can occur in real life at the community level? when it is transposed into into the virtual space. And that's an important goal for us. And I'll just end with where we are moving with your local epidemiologist to try and fill some of that gap. This was Caitlin Janelina. I know we've got it's 12:45. I'll just end with this example. So this is many of you may know your local epidemiologist, Caitlin, who's a friend and founder of YLE, formed this in March 2020 when she was working as an epi at University of Texas. Was pregnant, had a 2-year-old. Pandemic hit, and a lot of her family and friends were just concerned and interested in what was actually happening and knew that she was an epidemiologist. So she started just writing daily emails to her family and friends. Um, this is an example from like March 19th, 2020, one of the first with charts and things. They started getting forwarded around because it was offering information that the federal government was not, and others were not. There was meeting a demand for information that was not met elsewhere. And it took off, became a Facebook page, and then became a Substack post, which it is now. And now it has over 400,000 followers. And Caitlin was advising the CDC and the White House, and is one of Time Magazine's top 100. So it's a clear demonstration of the fact that a certain kind of communication is actually meeting a need. Um, and it's something that I tried to emulate as a health officer in Marin County, and I've now come into a role as the author of Your Local Epidemiologist California, which is the state version of YLE, and I issue a weekly public health newsletter, usually 3 to 5 topics per week, 300 to 500 words per topic, and it's just a way of informing people of what's occurring, and I'm listening to engaging with other community leaders in terms of trying to determine what's popping right now, capitalizing on some of the relationships I built as a health officer. So that's YLE California. It's definitely like a different form of communication. This is me, talking about vaccines with my dog to tell the story that vaccines bring freedom because the dog after after she got her shot, she was going to be able to play with her friends, but at that point couldn't. It's outside my comfort zone. It's personal and quick. It has a lot of advantages versus government communications. Um, so that's one example, and I want to thank UC Berkeley Social Impact Fellows and the UC Berkeley masters and graduate students that I'm working with on your local epidemiologists. I so value their input and their content, and we co-author pieces for the newsletter. So that was a quick romp through what I see as some of the key challenges for us in public health communications, really bringing a spirit of curiosity and humility, and marrying that with our expertise and using new communications channels to reach people in new ways, especially taking advantage of community trusted messengers. Thank you. That QR, if you want to subscribe, it's free. You can subscribe to your local epidemiologist in California. Yeah, again, it's a weekly, either a deep dive, 2,000 word deep dive into a given topic, or kind of a smorgasbord grab bag of what's popping at any given week. And we can do it. That's my son at the Rosie the Riveter Museum, reminding us that what we do is not just for now, but for the generations to come.
Awesome.
Thank you.
Well, thank you so much. That was fantastic talk. Thank you. We really, really appreciate your time and expertise and messaging. And one of the things I really like about your post is it's so easy to understand. Use language that everybody can relate to. And so I really appreciate that. Please ask questions either in the chat or you can unmute and raise your hand and ask a question. Okay, here's a question from Jordan. Are there any grants or funding opportunities that allow researchers to communicate their science through other modes of storytelling, videos, fiction, instead of academic jargon behind a paywall? That's a great question, Jordan.
Yes, I think this is definitely what I've tried to capture here, is obviously I'm not we are not the only ones thinking this way, and I think the foundations like Robert Wood Johnson Foundation, Kresge Foundation, some of the other important sort of funders of public health research are investing in this. I don't have a specific grant in mind, but I think, looking to those. I am partly funded by Robert Wood Johnson Foundation and a grant for public health communications through your local epidemiologist. So I think there's definitely a sort of a collective understanding that the old way is not going to fly any longer, and that we're still trying to find new ways, especially to integrate into the new information landscape that social media influencers have been so far ahead of us in public health, and how do we catch up and still maintain that sort of integrity around science that is so critical to our impact.
Great, thank you. Other questions? I thanks Valerie for your comment. Valerie Shapiro says she used the YLE with her undergrads this week to explore critical thinking without being critical. So that's great. Thank you. Uh,
I I can
yeah,
ask a
Fred.
question. Hi
Yeah, go
there.
ahead. Hi,
Hi,
Fred.
everyone. Fred Dillon with the Social Impact Team. Matt, I'm curious, as you've been doing YLE, what's most surprised you? Like, what's like come forward, or what have you been hearing from your audience, or anything along those lines that's maybe surprised you?
Yeah. Um, I think it's always a challenge that I sort of recognize one of the problems of social media as a thing in this, because people came to YLE, like people subscribe to my newsletter, right? And there's an assumption around what that means, like and I think a lot of my subscribers are, that little bubble I shared, or like where I'm blue. I'm like in a blue space, on the bubble, the blue were like the vaccine, pro-vaccine, and recognizing it was hard for us to access people who might be agnostic. So there's definitely sort of an issue of audience capture, if you will, where I recognize that sometimes my own personal beliefs around, like just an example, Fred, there was, I was sort of saying it's like it looks like a more mild COVID season, right? And that was a statement. And the comment, there's the folks that don't, there's an audience capture around COVID consciousness and COVID vigilance based on sort of historic, like Caitlin, came up, and I think a lot of my voice and authority within the Bay Area as a health communicator arose from people's fears around the pandemic, because I was leading that, helping lead. And so I think it's hard for some of those folks to hear that I'm actually not so concerned about COVID as compared to other things or whatever.
Mm.
And I can see that one of the challenges is how do you, as an author and as a communicator, kind of recognize that tendency towards playing to your audience and challenging people to see things in new ways when it can mean unsubscribe, right? And luckily, it doesn't matter. Like, I'm not funded through subscriptions, so I'm a little bit, I can recognize people who's really need those. Like, it's going to happen no matter, you're just going to get shunted towards what's affirming your audience. So that was, I think, the biggest thing for me.
Thank you. We have two comments in the chat, and then I want to get to Claudia's question as well. Charlotte wants to know, is there a role for voluntary organizations active in disasters, or is there a mandate too different?
Oh, absolutely. Yeah. The VOADs have been, so one of the things that I didn't get into here, I was really focusing more on the communications, but we are also working on developing a community messenger network within the state of California through Project Stethoscope, which is connected to the California Department of Public Health. And the notion there is to what I described, conceptually as a community messenger network, to actually build that out in terms of who are those actual organizations, like a line list, um, and that there would be a set of communications that when a given threat or issue emerges, that there's a communication that goes exactly to that group, maybe in a webinar, a forum where we talk it through, so they understand what the key messages are, they understand what is at stake, and they can become effective translators of that to the people they serve at the household level. That's the community messenger network we're building, and VOADs, volunteer organizations in aid in disasters. Are perfect examples of a community-based organization that would be part of that network.
Great, thank you. And Grace Gundy, who's a student, says, as a student, I want to be an effective science communicator, but I just don't have all the answers yet. How should we best approach conversations where we have missing knowledge?
Yeah. I mean, I think I don't know that. I mean, anyone who says they're like totally expert in this is the person not to trust. Um, I think curiosity to me is like the word that I keep going back to is like genuine curiosity. Like if someone disagrees with you, there's a reason, and 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 it's curiosity serves two things at least. One is that you learn yourself, right? In terms of just so tactically, like understanding what's behind the people who disagree is important as a knowledge thing. But it also creates trust, right? It actually creates those conditions, a safe, secure scene um, that Dr. Siegel talks about is actually created through that. So I think sort of an agnostic and a curious view is probably the most important. Doesn't mean you have to sort of um, change your beliefs. One of the things that Braver Angels, I should have mentioned, one of their principles is that we are not necessarily going to walk out of this agreeing. Consensus is not our goal,
Mhm.
right? Our goal is understanding other, right? And that's an act of curiosity.
Yeah, it's great. Yeah, thank you. And Claudia.
Hi, Matt.
Hey,
Um,
Claudia.
Thank you. This was really amazing. And I guess the question I would have is, as a school of public health and imagining training the next group of leaders in public health, how should we be shifting the way we approach public health education? What skills, what experiences, how could this look different to really embrace what you've just talked about?
Yeah, I think academics and public health departments share some of the same challenges here, and that we are wedded to traditional ways. We are institutionally slow in some ways. You know, we're bureaucracies in a certain sense. You've got your and that can be sort of an enemy to sort of rapid. I mean, I would say it's a challenge, and I think one is to what I've seen in the social impact program, which is so great, is actually connecting to communities. Like whatever is happening in the world needs to drive what's happening in academia rather than like expect it, to follow the other way around. It's a very simplistic construct, but I really think because things are changing so quickly within society at the household level in terms of the way people are getting information, what they trust, um, it's time for us to sort of step back with a point of humility, listen there, and then reverse engineer our processes to match that rather than expect. And this is what public health is doing, rather than expecting our doubling down on our existing sort of methods and messages, taking that step back. So I think, Claudia, I think the most important there would be those programs within Berkeley and within any academic institution that actually connect to the communities around you, like the people around you who are actually doing the work, and blending that sort of the excellence of the academia with the real life ground, ground truth. Ground truth. We need to sort of ground everything and we only get that ground truth through relationships with community members.
Fantastic. Yeah, agree. Thank you. One last question. I know we're just about at time, but Kathy on says she's interested in pursuing a career in infectious disease therapeutics, and is also interested in public health communication. How would you recommend she become involved in public health communication alongside her primary career interests? It's a great question.
Yeah. I mean, I guess one is just to recognize you are a communicator no matter
Mhm.
what. Like, like it or not, you are a public health communicator, you're a health communicator, as an infectious disease doc. So, I mean, we know that one of the preserved, like people trust clinicians, like, and you will be trusted. And so investing a little bit in actually learning, communication styles. I mean, if you're interested, you could reach out, my email's there. You could reach out to me. I'd love to talk to you. Is that you, Kathy? Yeah.
Great.
All right. Yeah, let's talk.
Great. Thank
Because
you.
we
Well,
could we
thank
could
you.
maybe go in together on a piece and co-author
Yeah.
something, however.
Yeah, that's awesome. Well, thank you so much, Matt. We really appreciate your time today and really appreciate all of your knowledge and expertise. And thanks to everyone for coming and hope you have a good day. Thank you.
Great seeing
Take
everybody.
care.
Thanks.
Thank you. Bye bye.
Bye.